You think he or she is doing what they are doing intentionally. Let me tell you, have you experienced dementia or Alzheimer's disease or any cognitive impairment in a loved one or someone you're close to? Then you will understand. Before I got knowledgeable about what dementia or cognitive impairment or mental health illnesses is, I used to think that people do what they do intentionally. I used to think that when a man of 70 years you're caring for begins to showcase some aggressive behavior, they are doing it intentionally or just to hurt you. Excuse me. Hello. There is something called dementia. There is something called Alzheimer's disease. There is something called depression. There is something, oh my God, there is something called delirium. These things have to do with the brain. It have to do with the brain. It have to do with our cognitive part of our body, of our being. So, my dear, they don't know what they are doing. You might think that they know, because there are different kinds of dementia that sometimes you begin to wonder, you begin to feel like they know what they are doing. But my dear, some of them, in fact, they don't. Not some of them, they don't. That is why gentle, persuasive approach is a very powerful tool in dealing with mental health sicknesses or any sickness that have to do with cognitive impairment. That is why validation therapy will help you to care for your patient 10 times better than someone that do not understand what validation therapy is. That is why redirection is a skill that every person working with this set of people need to have. Someone is looking for me. Okay, I will talk more about what gentle persuasive approach is, what validation therapy is, how you can build skill in redirection so you can be a very great caregiver.